First of all, thank you. My name's Alex Garaya. With me, we have our data scientist, Igor Alcantara. And we're going to walk you real quickly through what we do on a day-to-day from a data analytics standpoint. And one of the things we do is we work with some of our media partners here locally. And so the first thing we're going to start with is a little video from one of the anchors at WSB-TV. So Isaac, let me know if you can hear it just fine, okay?
I can hear.
My name is Wendy Corona. I'm a reporter at WSB-TV Channel 2. Now, why is data necessary? Well, that's all we do over here. We gather data, we gather information, and relay it to you in the simplest way possible. During this pandemic, nothing has been easy, but what we have done is we've tried to make it easier by partnering with IPC Global, which is a data cruncher, if you will, based out of Alpharetta, Georgia. They have been taking in all of the numbers in regards to this pandemic as to the number of COVID cases, hospitalizations, the percentage of the hospital beds in use, deaths. They have all this information and they are bringing it down basically to the community, the neighborhood, your county, so that you can pinpoint how this affects you personally. It has been a really great symbiotic relationship in terms of trying to make sense of all this information that's coming at us and simplifying it in a way that we can understand it and then make the viewers, people at home who are watching TV trying to get informed, understand it as well. That's just one way how we've been using data here lately. Me specifically with IPC Global, with a number of reports that I've done throughout the pandemic. Now, this is just one way in which data is used, but it's the most recent and I think the most hard-hitting because these numbers come at us every day from the Department of Public Health, from the governor's office, from so many different aspects that we then have to take in and make sense of. And with the help of all the folks at IPC Global who know what they're doing when it comes to this data, we're able to do our jobs as well and get the information out to viewers. It's something that may be of interest to you. It might blow your mind and you want to know more about it and say, hey, this could be something that I can get into. It's really worthwhile checking it out. It's really blown my mind just working with the whole team over there to see how it is that they work all of the information that they get. So anyhow, just one way that it's worked, and I hope that this helps you out. Maybe it ends up becoming what you do in life. Good luck to you. Hope this helps. Talk to you soon. Take care. Stay safe.
So guys, that's Wendy Corona, the anchor of WSB-TV. One of the things we're going to show you that Igor's going to walk you through is also what we're doing to help schools and what we call the campus health tracker. And it's a way for us to help schools understand what's going on in their ecosystem. So I'm going to turn it over to Igor, and then we'll kind of open it up for some questions.
All right, let me know if you can see my screen.
Yep, we can see it.
Okay, when we have any situation that you need to analyze, when you need to act on it, it is important to have information to understand that, and for that we need data, and we need data in a visual, smart, and fast way. So this is an example. Of course, this is a demo data, but this is an example of things we use in schools to track and report on the COVID cases, suspect cases, etc. So first thing is you see is like an overview, like how many kids are sick today because of many reasons. It could be COVID or other reasons. So then we see, for example, for middle school, high school, or school pre-K, what is the percentage and how many kids are sick today. We also see when they're sick and they have to self-quarantine, how many days in average it takes for them to get back to school, so we can plan, for example, how many days they will need to be on online classes. So, for example, high school, an average of 23 days, and middle school, an average, or lower school, I'm sorry, an average of 32 days. And then we see the number of positive cases per week over time. And then we can see also a text report on that, like how many people we have with COVID in high school, how many people in high school are self-quarantine, and same thing for lower school, middle school, etc. What is interesting is when you get into the school, then the secretaries or whoever is in the front desk can actually check if you're supposed to be in school or you're supposed to be remote learning because of your status. So we have some protocols in place, like we have something called a yellow protocol. So it means that you can come to school, but you should wear a mask at all time, and you should keep a higher distance from other students. Or you're in a red protocol, it means you have to be at home because you either were tested positive or you were in close contact with someone tested positive. And then you also see how many days until this person is allowed to come back physically to the school. And then we have some overall numbers here, some statistics. But what is interesting is, let's pick one student, for example. Let's pick Viviana Kirk, for example. So she's in the red protocol. She was exposed to someone, but let's say we want to see everyone that she was in contact with. That's the beauty of what data provides. So I can come to contact tracing, and then I can see, wow, she was in contact with all of these people. And then I can see how many places they were in contact with, like how many classes they had together, for example. And then I can then contact, I have their phone number and all the data. I can contact those parents to let them know, listen, your child was in contact with someone that would place in a red protocol. We might be aware if you can get a test, or maybe you decided to do remote learning for a while, or maybe we decided to put them also in self-quarantine because of the number of contacts. They were too close to that student. And so this is something that it's simple to see, simple to visualize, but it requires a lot of work internally. And that's one of the things people like myself, a data scientist, do. So you apply science to data, and then we can use science to do the second best thing science can do. The first is have fun. The second is to solve our day-to-day problems. And so that's a basic. Of course, there are other things, but I'll try to get to exactly the point. But this is the basic. Lastly, we can also, let me filter her out so we can see everyone. We can see, for example, let me filter middle school, for example, here. We can see for in a day, for example, this is today's classes for middle school. There's all the students. These are the classes they will have during the day. And then we see a color code that says, do we have anyone in any protocol on that class? So we need to take precautions. So this is pretty simple. If we didn't have that, then the school staff will have to go over manually like a lot of lists, and they'll take a lot of time. And when we're able to take action, will be probably 2-3 days later. But now we can do it immediately. Let's see for this, for example. So these students, she is probably the one in protocol. So all of her classes shows that she's in protocol. Then I can select a specific class or period and see all the students, and then I can combine the data. And that's most what these data type applications do. So that's basically these health tracker that can be applied to COVID, but also can be applied to anything in health relations.
So, Igor, thank you so much. So there are two things that we do, as Igor says. We take all this data and we put it in a way that you're able to use it to make decisions, like who to quarantine, how many days are left for someone to come back, how do I send information to the Department of Health? So a lot of those pieces. But you also heard from Wendy in WSB that we also take data to tell stories. And really that's what data does, is we create visuals like you see here to tell a story. Because a lot of times we, as consumers of information, it's easier for us to look at the data and look at a picture to understand the data. So that, in essence, a data scientist takes all this complex information, makes it workable to our community, and makes it something that you can consume very easily and tell stories. Whether it's a news story, whether it's a health story, like what he just showed you here, but the intent behind it is so that we can make smart, good, and valid decisions based on data, not on what we think. So I'm going to pause there and open it up for questions. I'm going to put Mr. Isaac on the spot here as the teacher. You have any questions you may be able to ask?
Well, really, what I would like to say is this is good for tracking data, but it has to be reported correctly in order for us to actually analyze it. And that's one thing that I and several other science teachers throughout the county are wondering. Is the data being reported correctly?
Great question. So this data that we're just showing you here is using your student information system.
Yes.
And Isaac brings in a very good piece of, and the nurses' clinical information. So we've combined pieces of it, and then we add supplemental Department of Health data. So the data here is accurate in respects because it's pulling from the sources of those data. At the bigger picture, which is what you're asking, is, are my COVID numbers correct? Obviously, from our standpoint, there's some dependency that we have in our government to provide some of that level of information, whether assuming from our standpoint, we'd have to assume that they're providing accurate information. But Isaac hits it on Mr. Seals hits on a very important point, is our data, if you're using bad data, then you have bad output, right? So it's important that as you're working as a data scientist, is that you're also validating the information to ensure the level of accuracy around it. Great question, Mr. Seals.
Can I add just something real quick? It is, I agree absolutely 100%. It is true that the quality of what we present depends on the quality of the data that is provided. But also we do have some science in general, we have a very powerful tool that can tell us if a data is accurate or how close to accurate data is, which is the statistics. There's a lot of tools that a statistic can provide. We can compare like a sample, which is a school, to an overall number, and we see if it follows like the normal statistics. If it doesn't, then it might be an indication that, well, maybe this is bad data. Maybe not. Maybe it's just a particular case, but maybe it's bad data. And in regards to COVID, for example, there are some places, like some countries, for example, they underreporting the number of cases, but they cannot underreport number of deaths because that's you cannot, people is either dead or not, and so that's easy. So then we compare like mortality rates, etc., and you say, oh yeah, they underreporting number of cases because maybe they are not testing enough. But then we can adjust and we see, well, based on the expected mortality rate, we expect the number of cases should be between X and Y, for example. Don't get too in detail here, but my point is the data science statistics itself provides tools for us to identify the quality of the data, so then we can get back and get better data.
Great question. Any other questions from some of the kids? We have Aja, Taya, Kayla, and Christina. Any questions from you guys? And I think you may have to unmute if you want to ask a question.
I don't have a question to ask.
Okay, great. Well, that's we actually wanted to cover for now. Enjoy the rest of your virtual visits to other solutions and technologies. We certainly hope that this was interesting. I think for you guys who are interested in science or math, this is a great pathway because every single company whether it's medical, healthcare, education, needs data to make decisions. So this is a great pathway for someone who would be interested in, from a career standpoint, applying science and math.
Well, this goes right along with what my class, well, some of the things that my class has been studying. We've been tracking this virus. I started tracking it last semester in March, and then my students this year have been tracking this virus since I was out for a while, but we picked it back up in October, and we've been tracking it ever since. So this is very, very useful for us, and to actually hear what you're saying, it's been very useful, beneficial.
That's great. Well, since you guys are tracking this, I'm going to point you to our website, Mr. Seals. We created a COVID tracking site that captures everything relating to COVID, whether it is cases or deaths, and this is kind of a distribution, and you can see how Georgia's doing as an example. And you can see that obviously our numbers are starting to improve. Overall, we can look at each specific county, and this is available for free on our website. So your students can actually feel free to go in there and use it, and then use it for some of your information. You can see how Fulton County's doing. You can see they're improving in cases, but also they're now starting to plateau on deaths. And as your students probably know, because you've probably told them, is our cases, deaths tend to trail cases. You're going to have, it's a lagging indicator.
Yes.
We've also have things for like loans. Part of the COVID is we've lent businesses money and how they're using that money across the board. So that's available there. We have vaccine distribution information. So that's something that you can, if you go to the IPC Global website and then you click on interactive apps, you'll see a COVID dashboard that you'll be able to use. And will help you kind of keep track of what's going on.
I would love that. As a matter of fact, I will probably post that on my Teams page for all of my classes.
Great.
I teach environmental science all day. I 3 sessions per day. So
That's
great.
great.
Yeah.
very,
And
very
if you have any questions, feel free to, or if your kids have any questions, feel free to shoot them across to me. I'll be more than happy to help. But this is what we work with WSB on. We kind of help them develop stories. And as Igor mentioned, data tells not only stories, but we can identify whether some data is being manipulated. And we did a segment with WSB where we did find that on the loan side of the house. And they did a story on a business that looks like they were manipulating some of the numbers for their loan. So science and math combined is a great combination.
Well, this has been very beneficial. I really appreciate this.
Thank you for your time, guys. We really appreciate you guys joining. Enjoy the rest of your time in the other segments.
All right. Thank you.
Thank you.
Bye.
Thank you.
Bye, guys.